Yeah, this meeting. No, I don't plan on it. And the wind's going to go from no.
Okay.
I said a while ago, and asked them to commercial loan. Okay, we're kind of into it.
I'd like to call to order a regular meeting of the Summers Board of Selectmen. Today is Thursday, February 1st, 2024, 6 p.m. We're at Town Hall. I'd like to start off by please join me in the Pledge of Allegiance. Thank you. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Okay, so this evening, on the roll call, we have Selectman Bill Meyer on my right, Selectman Bob Schmidt on my left. We have Fire Chief John Roach. We have several members of the fire department, including Ray Stovall, the fire union. Is your title chief or what?
President.
Is president. President, okay. Make sure I get the right title. Yeah. Mike Marinaccio, Assistant Treasurer, Brian Wissinger, CFO, Karen Neal, Town Assessor, and we have Kim LaFleur, our Operations Director, at the table with us, and an NBC crew, including Jeremy Chen and a cameraman. I didn't get your name, but Mark, just Mark. Big Mark, okay, all right. He's got a great handshake, I can tell you that much. Okay, so that's it for, we also have some guests. I don't know all the guests, so maybe just introduce yourselves.
Kelly Delaney, Riverburn Scully.
Josh Walken, State Colorado.
And? Okay.
Top secret.
Yeah, exactly. Thank you. Public comment. Do we have anybody that wants to make any public comments this evening? Hearing none, we have none. Presentations by the first selectman. The only thing I have to say is that I did talk to our consultant for human resources, Kathy Lampkin, this past Monday. I had a discussion with her about her efforts to try to find us a part-time HR person. She's still in the midst of that. She had two candidates that she thought were valid and worth reviewing, which and there were some people that hadn't responded yet to her questionnaire. The deadline was the 1st of February today, so we expect to have a meeting, Zoom meeting with Kathy Lampkin on Monday with some interviews with candidates. That'll be at 11 o'clock on Monday morning. Yeah.
Okay.
Probably go no longer than 2 hours. I think.
Okay.
Yeah.
Thank you.
Okay. Consent agenda, boards and commissions. I think we have none there. Opportunity to add urgent agenda items. Do we have any of those?
No, I don't.
This evening?
No.
Bob?
No, I have none.
No, okay. Finance, transfers and appropriations.
There's none tonight.
CFO finance report.
Nothing really new, no.
Okay. Presentation of scheduled payments, FC. Let's see here. I've gone over the list, and initially we need a motion to consider the matter.
Yeah, I'm happy to make a motion to authorize the payment of $43,950.58.
I'll second that.
Okay. Any discussion on the motion?
I have none.
Okay. I've reviewed the items and had no questions myself, so Hearing none, no discussion. All those in favor of the motion say aye.
Aye.
Aye, motion passes. Okay. Here you go, Bill. Next item on the agenda, updates from boards and commissions. We have none there. Okay. Pending business, none. New business. The first item we have under new business is to authorize the first selectman to sign the settlement agreement between 520 Hall Hill Road LLC, that's Mr. Jarmock, and the town of Summers. It's something we've been working on for quite some time. Our Carl Landolina, our town attorney, is available if we need to call him on the phone. I've looked over the agreement and believe it to be satisfactory. Do we have any questions?
I don't have any questions, no.
I have none, looks very clear.
I make a motion to approve the settlement agreement and authorize the first selectman to execute it between the town of Summers and 520 Hall Hill Road LLC as presented.
Second?
Any further discussion? All those in favor of the motion say aye.
Aye.
Aye. Motion passes. Thank you.
Thank you.
You're welcome.
Good work, Karen.
I rehearsed the speech.
You whipped him into shape.
The next item is to authorize the first selectman to sign an agreement with the cemetery landscaper for a 3-year pricing period. Mr. Wissinger, do you have anything you want to say to that?
Yeah, back in the January meeting of the cemetery committee, I forget the exact date, January 9th, for some reason rings a bell. They unanimously voted to extend their current agreement with Guzzi Landscaping. The contract pricing goes up 10% over the current prices and then stays flat for 3 years. So it's a one-time 10% increase. These rates are comparable to the same rates we were paying in 2015. So 9 years later, we've gotten back to where we were there. So.
Wow.
Sounds good to me.
Did we resolve some of those outstanding issues? I mean, I know stuff we've talked about. I mean, I know we're in the middle of budget, but
Not really, no.
No, we haven't.
I think we just need to move them forward, though, with or without the
We've been trying to move them
But
forward.
with or without the commission.
I agree.
Yeah,
Yeah.
I agree with you too.
Yeah.
I had spoken to Brian before, and he has a plan, so I would hope that we could implement that plan.
Yeah, they've had enough time to work on it.
Yeah,
so
there
I
was
think
supposed to be a special meeting next week.
Okay.
But I still haven't even heard any notice about that to know if that's actually gonna happen or
Okay.
not.
Maybe in March, we can add that to our agenda, and then we'll just move
Yeah.
it forward.
All right.
Yeah, I'd like to get that settled.
Yeah.
Thank you.
Then we need a motion.
I'm happy to make a motion to approve the,
Authorize.
authorize the approval. Is that better?
Authorize first selectman to sign an agreement.
Okay,
Yeah.
authorize first selectman to sign an agreement with,
Cemetery
Guzzi
landscape.
Landscaping LLC
Yep,
for the next 3 years.
great.
I'll second that.
Any further discussion on the motion? Hearing none, all those in favor of the motion say aye.
Aye.
Aye, motion passes. Thank you. Presentation of the fire department budget. Chief Roach.
New numbers hot off the presses. Brian and I were working on them today.
I already gave him copies of it,
Okay, I
John.
got a slightly different just layout, just because I combined fire and EMS on one page. And it's
Oh, okay.
easier to kind of, as opposed to jumping back and forth.
Thank you.
Numbers.
Okay.
Thank you.
Not sure.
Same presentation, right?
Slightly changed.
Okay.
It added a little more after
All right,
the discussion this
good.
morning
Okay,
that we had with.
Good.
Follow-up.
oh, yeah. Okay.
So, obviously, you got the budget before you. So the budget, as you know, is, there's two parts to the budget. The top part is the fire department budget. That's what comes out of the town's, general fund. Is this on?
Yeah, those are both on.
Cool. And the bottom part is the EMS piece of the budget. That is the piece that is funded from, ambulance billing revenues. Not directly by the town's citizens, but by, insurance payments and such directly from the ambulance and the services that we provide there. So just at a high level, kind of walking through the PowerPoint first. Call volume over the last couple of years, we got questions about the call volume. Last year we were 2460 roughly for our call volume, down slightly from 22, but greater than 2021. So the call volume is still fairly high. As you know, between 22 and 23 we were expecting a significant dip because Trinity Ambulance was going to be supposed to be handling most of the calls in Stafford for the ALS. So we saw a little bit of a dip, but not quite as much as some people or we might have expected. Other than that, the fires are fairly consistent. Auto accidents are up. Service calls, weather-related calls are all kind of fairly consistent. The big thing, the big variable, obviously the blue bar on that chart is the EMS number of calls. So call volume overall is again up over 21. Down slightly from 22, but I'm thinking 24 is probably going to be similar, if not up again slightly.
Chief, was there a graph that showed calls in Summers versus not in Summers?
Not in this presentation. We did do it as part of the annual report. I believe about 600 of the calls were not in Summers.
Nine.
Or 9, it might have been.
900?
I don't have the numbers off the top of my head.
873 is what I have.
Okay.
So about 1/3 of the calls were outside of Summers?
Could be. Yep.
Okay.
Total
And that's
calls.
most of the increase in 2019
So that's
are actually calls outside of Summers, right? calls in
No,
Summers
we
are
did look at
very-
the call volume in Summers went up as well, so,
Slightly.
yeah, it's like about 10% a year.
It's
Okay.
one-third of call volume, but it's probably one-half of EMS.
Yeah, it's one-third of total call volume. It's 48% of EMS calls.
Okay. Because that's just not shown on the graph. I want to
Yeah.
just make sure everyone's clear. That most of the increase is actually out of town.
Yeah,
And not
and
in
we've been
Summers.
busy with fire calls out of town and
Okay.
other things as well, so, yep.
Okay.
The next is just, another topic that we're just gonna talk about is the, volunteer coverage. Just something, a trend that we've been keeping an eye on. Open shifts on, as you know, our staffing model is to have career staff Monday through Friday, 6 a.m. to 6 p.m., staffing the two ambulances. And predominantly, we only have one paramedic on at night with, volunteers staffing the ambulance nights and weekends. That's what model we've really been trying to go with. We do have a really dedicated core number of volunteers that we're still trying to work with, but it's been getting harder and harder over the years. The numbers are slowly declining, and the time commitments are getting harder and harder. Every year we'd see a little bump of like open shifts, August, September. A lot of times that's college kids that were around during the summer. They went back to college, and then it would take some time for those shifts to kind of get refilled and reacclimated. But we noticed in the end of 22, we started having 10 or 15 shifts a month. We'd have some holes in them. Sometimes we could cover them with scramble crews. Sometimes the medic could help make the crew. But we're noticing now it's getting to the point where every week we're having 5, 6 open shifts. Again, sometimes we can put the medic on it, sometimes we can't. The downside is if you put the medic on a BLS ambulance, now you don't have a paramedic, you may only have a BLS ambulance, and you're tying up that paramedic resource doing what may not be appropriate. I mean, they can provide the care, it's a little bit harder.
Did you also hire someone to help you with regards to recruitment?
We did have somebody in for a little bit for volunteer recruitment. They came in for a couple of months. They did help redo our Facebook part. They did some marketing with us, redid a lot of our flyers and materials. They updated the town website, which hadn't been updated in years. And they sat with our volunteer membership committee. We've got 3 or 4 members that are really active, and she gave them a framework on how to continue to maintain that momentum. So, how to do a post. They didn't want to get to the point where you're posting every day, kind of get overwhelming, but okay. So maybe Monday we're going to do a pictures on Facebook of what did we do for drill last night. And then maybe Thursday would be a fire safety or an educational tip. And then maybe Saturday would be, hey, we had a big call or we did some driver training or something like that. So 2 or 3 messages a week, but we actually laid a calendar out for the year with them, which was really beneficial for, okay, it's fire safety, it's chimney season, or it's Christmas trees season, or it's space heaters, so we tried out laying the calendar with them, and it got them focused on a lot of things, got them looking at, how can we do a lot more outreach with community events? We are trying to get the volunteers and the numbers of participation up.
So the trend is open shifts on nights and weekends?
Correct.
So that means that you have volunteers, but they don't want to serve on nights and weekends?
Yeah, it's getting harder, or they're not being able to cover as many shifts, so some volunteers were covering 2 or 3 shifts a week, and now they're only...
is there more here when you look at, try to get behind what's really driving these numbers? Is that really one of the drivers?
Yeah, it's getting harder and harder to get the volunteers in, and getting them in, and also...
Once they are in, they don't want to serve on nights and weekends?
As often, correct. Or we're getting faster turnovers, they're not staying as long. So we'll get people in.
You have fewer people.
Yep, we're getting fewer people in the door, and then when they stay, as opposed to staying for 7, 8 years, they're staying for 3 years, and it takes a year or 2 to get somebody up and running off to speed. So the turnover's faster, the higher, it's not a unique problem to Summers, but we're struggling with, people aren't interested in getting into some of these fields, after COVID and a lot of things like that. Healthcare is kind of a topic in an area that everybody, nurses, doctors, EMS, paramedics, everybody's struggling to get staffing. The other thing is just getting very competitive in the area regionally for these positions. So I was talking with some of the selectmen prior, they can volunteer in Summers for free at night, or they can go work at Trinity Ambulance at Johnson Hospital for $25 an hour. Well, if you're 19 years old, that's not real hard to make that decision. You're going to go work up at Trinity Ambulance for $25 an hour. And they're gonna run, so I've lost some members to things like that. So we'll put them through the training, and yeah, they do a couple shifts here and there, but then they'll still they're working at neighboring departments where they can get paid.
And that's part-time work they're doing for Trinity?
Yep, they'll do Trinity, they're doing Stafford, they're doing ASM. I mean, we've got people that are picking up these jobs. So, I mean, they're getting the foot in the door, and we're training them, but then they're taking that, and if they've got the time, they're getting paid.
Gotcha, okay.
So just as an example, the next slide is just like this week's schedule. Wherever you see the highlighted unassigned are like shifts that we don't have a full crew on. So as you can see, normally on our scheduling software, we have a driver and a tech, and it just happens to be there are shifts that we just have openings. So sometimes we can cover with the medic, sometimes we can't. Unfortunately, in the state of Connecticut, not that I agree with it, but like an EMR can't make, and a paramedic don't make a legal crew in an ambulance. It has to be an EMT and a paramedic, so it's a different level of training. So we may have a lot of volunteers, but the volunteers, it's not the right volunteer to match up with the paramedic, so they can't run the ambulance properly.
So Chief, I just want to clarify on this. So like I'm looking here, like Sunday, for instance.
Yep.
You have a driver EMT.
Yep, but no tech. So he can do either drive or an EMT, but he can't.
But with the medic, that's a legal crew.
That is a legal crew.
So we actually have a crew because we have a 24-hour medic. So that's not an open shift because, and that was the design I remember when we built this, was that especially on the overnights, the medic will be the second person. And if it's a BLS call, the medic would drive. So that the Summers residents, we'd have a crew for Summers residents.
Sometimes, yeah, they can do that sometimes.
Right?
Yeah,
No, that was what was presented.
Correct, but if there's an EMR, they can't drive and let the EMR...
Well, I see one opening on Monday where there's an EMR only, so that's not a crew.
Correct,
But
and
then
like
the next
Sunday at 6 from 6 to 12, there's no driver and no tech.
But I'm just looking, so Chief, like Tuesday, you have a crew, so you have a driver EMT, so that's a crew.
Yep.
Wednesday, you have a driver EMT, that's a crew. Thursday...
He's not an EMT, he's precepting, so he can't make us a crew.
Okay, then Thursday, you have a driver EMT, that's a crew.
No EMR, Sam Corvo's on at midnight with no tech on Thursday, 0 to 6. So he's an EMR.
Well, that one's not highlighted, okay.
It is the bottom.
Oh, at the bottom?
At the bottom.
Okay.
So Sam and the paramedic do not make a legal crew.
So, I mean, but this, I mean, I remember I used to run the schedule
It works
years
up,
ago.
yes, there are some that we can
I mean,
fill,
it's
but
not
not all.
much different than what we've had historically.
We're getting, the trend is we're getting more and more of these gaps. Yes, up until 2021, 22, we were able to cover 100% and make things work. Are we having gaps every day, all the night? Are we absolutely at the point where I've got openings all the time? No. But I am consistently every week getting 2 or 3 openings where we now have, like on the Sunday, from 6 to noon, I've got no driver, no tech. So the medic doesn't make a legal crew, as you pointed out. So Thursday morning from midnight to 6 a.m. Sam's a driver, but he's an EMR. I don't have a tech. So that's 2 shifts in this week that I don't have legal
So what are your
crews.
options?
Right now, we've been doing the best we can. We try to do retone. we try to maybe open it up to part-timers. I have not been opening up to the full-timers because that costs overtime and I don't have the budget for that.
And how many calls have we missed?
Probably in the last 6 months, probably 20 or so.
We missed 20 calls that mutual aid had to come and do a
Yep.
transport?
Mm-hmm.
Interesting.
I don't have that data anywhere.
I don't have
You
that
wouldn't,
either.
because let's say if it's an East Windsor comes in or an Ellington comes
They
in.
still bill us for it.
No, they don't. They bill the patient directly. They only bill us if we do an intercept with our medics and things like that. If or Enfield ambulance comes in and picks up a patient and transports, we do not get any bill whatsoever. You only get a bill if the Enfield medic gets on the Summers truck because we don't have a medic available. Because that's the intercept, and they will get paid for the intercept. You will not see a bill, Summers will not see a bill at all if the Enfield truck comes in, picks up the patient, and does the transport completely.
Can you send us a list of the dates and times of those calls that we missed? I mean, it should be easy to run.
I can dig through it, yep.
Yeah, okay. I'm curious to see if there's any trend. You know, if it's midnight, if it's Saturday. I know historically, like, sometimes the midnight to 6 or
It's Friday, Saturday nights, Saturday, and a little bit of Sunday mornings.
That's what I'm trying to see, where the gaps are.
And that's where, when I was talking with Mr. Keeney earlier about what we're looking for possible staffing, my plan or my hope is to fill the Friday, Saturday night, early Sunday morning. That's where I'm really having a hard time. And I also have, to be honest, I've got some part-timers that they're interested in working Monday through Friday, so they're not always picking up. So I'll post the shift on a Saturday night, and the part-timers aren't picking it up either. So it kind of limits some of my options. So that's something that we're looking at. This is a trend that's going to get into some of the discussions when we get into the budget.
Chief, I just talked to a volunteer last night,
Yeah.
and he's...
I mean, you run into a situation where you know right off the bat who doesn't want to work on the weekend, so when you made the schedule up, you put in the people you know who...
No, the volunteers get to pick their own. We don't assign them at all. We
They-
post the open schedule and they pick what they want.
They choose, yeah.
I got it, thank you.
They're volunteers.
So,
thank you.
back to what I was saying, I talked to one of the gentlemen that's on your list here,
Yeah.
and I just wanted your opinion on it. I heard his, but, and again, I talked to Roy for quite a while last Friday, and it seems that you need I need to hire another person,
Yes.
at least in my opinion. But this person was saying that if you hire another person, then the volunteers are going to get upset and not volunteer anymore.
Yeah. It's a risk.
It's a risk.
I
Okay.
think it's almost a certainty.
Well, that's what he was saying. I didn't know.
We addressed that when we first went with the medic. Everybody was like, oh my God, you're going to put the medic on 24/7 and all your volunteers are going to quit.
Right. Didn't happen.
It didn't happen.
Okay.
So there's a way to do it. There's an approach to do it. You have to work with people. You have to balance it.
Okay.
But what would be the reason for a volunteer to get out of bed or to volunteer? I mean, if they're not needed, why would they respond?
But they are needed. They would still fill up the crew and things like that. So
I mean, like Vernon, for instance, they're a paid service.
Yep.
No volunteer wakes up in the middle of the night and goes. They run a two-person ambulance crew, and that's the only ones that respond, unless it's like a really heavy patient or something.
So as I said, we work through it. I mean, that's the proposal is. The other alternative is you go with multiple paid staff to go completely fill all your 24/7, which was not my proposal.
Well, then my concern though would be, like, say there's a second call, there's then no volunteer to go because you don't have an ambulance corps anymore,
Yeah.
right?
Yeah, that's what I said. You have to be judicious on how you roll this out. That's what I said. But when you have it, when I've been able to sit with some of the officers and the leadership of the volunteer side and say, look, Sunday morning nobody wants to work. Like, it's open every week, all the time.
Correct.
Is it okay if I put a paid person on that day shift? And they're like, go for it, please.
Do you have
You're not scaring the volunteers away. They don't want to work it.
So you having a lot of trouble on Friday nights from like 12 to 6?
It's Friday night, Saturday night, Sunday morning.
Yeah,
So-
that makes sense, you know?
So if you get down to the essence of the volunteerism, we have a stipend system, which then has certain criteria that has to be met in order for them to get a stipend.
Yep.
Working on weekends, is that a stipend issue?
Nope.
No. Maybe it should be.
Well, they've tried that in the past.
We
The problem
have
is-
years of service that count toward retirement.
Yep.
If you work on weekends, shouldn't that be an issue?
To be honest,
So
a
in essence, you-
19-year-old doesn't care about the pension.
No, well,
You get
okay.
$5 a year, when they're 19, they don't care what the pension's gonna be
Okay,
when
so
they're
then
65.
then they shouldn't be
Yep.
awarded any years of service then.
Most of these people
no.
come and go before they earn them, so, I mean, it doesn't, they
Well,
don't...
what's the problem you're trying to solve, like, by bringing this data? Like, what are you trying to
I'm
do?
showing that we're having gaps, and so my proposal is to hire one more full-time position this year, and to put them on nights and weekends, strategically, where the volunteers have said or indicated they're not interested in filling those shifts.
Well, it looks like you had the data to support it.
So how's Trinity staffing their ambulance? You just told us how they're staffing their ambulance.
They're throwing a lot of money at it, yeah.
Well, no, they're hiring, you said part-time people, and they're paying them, and then, like, your own members, you just told us 5 minutes ago, are going to work for them to get paid.
Some of them.
So why don't we pay them here?
If you want me to hire more part-timers, sure.
Why wouldn't we? I mean, it seems like a logical approach. I mean, I would
Some of
support that every day, right?
But as I said, sometimes we've tried bringing them on, and then
Well,
we
you
say,
just
cool,
said
we
it's
want...
work for Trinity, right? I mean, you just said they hire part-time people, they pay them
Sometimes it does,
$25 an
sometimes it
hour.
doesn't.
Well, every other agency around here does it too.
As you point, yeah, every other agency around us is paid 24 hours a day.
No, they're not.
Every neighboring department has a 24-hour paid ambulance. That if the shift's open, it's paid. Allington does it, Enfield does it, East Windsor does it, East Longmeadow, Hamden, Stafford Ambulance has paid shifts. They don't always fill them, but they have paid slots. So every neighboring department has 24 hours paid. We're trying not to go there. We're trying to respect the
With
volunteers.
full-time staff or part-time staff?
They've got a mix, and I don't know how
Yeah.
each department...
That's what I'm saying. I mean, I'm okay with Saturday night, midnight to 6, putting a part-time person on. I'm fine with it.
Yeah.
So why don't we explore that?
We've tried that in the past. Sometimes they just have, the part-timers haven't been picking up the shifts.
Well, can't we hire someone for that purpose? Say, listen, you're being hired to run midnight to 6 Saturday.
Yeah, I'm not sure what we get for a response.
We
I
tried
guess
it?
my question on it is, for 24/7 coverage, to have 2 people on 24/7, 365, is 336 coverage hours a week. 8 full-time people at 42 hours a week is also 336
That
hours.
doesn't give me 2 ambulances Monday through Friday.
It doesn't give you 2 ambulances.
But I need 2
But how-
ambulances Monday.
okay, so
My
how
call
many-
volumes needs the 2 ambulances.
How many
Monday through
second calls in summers have we had?
25%, 20% of our calls are second calls.
In summers.
In
In
summers.
In summers? That's not true.
Actually, yeah, usually...
We're the first and second caller in
Are
summers.
both in summers.
Typically, because the ambulance, it's the supply car that's going out of town, it's not the ambulance.
You're probably doing 1 or 2 a month. Second calls in summers.
No, we're doing...
Especially ALS. Well, can we see the numbers?
Yeah,
I
dig
mean,
into
I've
it.
asked for
I mean,
5 years.
If it was a second call and infield was coming, is that an issue?
Can be, it depends on how long it takes them, because they're on the far end of town. Problem is, we're trying to...
I guess I don't understand how I can,
We're trying to keep but there's more to it than just, and I'm gonna get some more future slides, is more to it than just the ambulances. We also have to provide first due fire coverage for the prisons. They're looking for a 4-man engine.
Yeah.
I can't do that with 2 people Monday through Friday.
But I mean, can you do it when your paramedic, that one of your firefighters also is on a call out of town and then at Hartford Hospital with an out-of-town patient?
No, that's why I've been covering the calls a lot. That's why, I mean, we're talking about the
I
fact
mean,
that
that's what I'm
I've been
saying.
running ragged, but yeah.
Yeah. I mean, we're kind of talking out of both sides. Like, we need
No.
the people, we need the coverage,
We do
but
need
then
the
we're
people.
sending our people out of town.
We don't have a say in where they go necessarily.
We do. We do have a say.
How does that work?
my concern is if 48% of our calls are somewhere other than Summers, I'm asking the taxpayers to give me $1 and I'm gonna send 48 cents of it somewhere else. So for every dollar, so for a $100,000 employee, $48,000 of that service is going to a neighboring town.
And then you're getting the revenue recovery back from the ambulance.
I'm not getting the
We're not
recovery
getting it.
back, though. I'm getting a portion of it,
Correct.
but I'm asking a taxpayer to
But
pay
if you look
to
at the
go,
budget, if you did-
to
if we did-
send
if you
service
cut-
somewhere else.
If we didn't add this extra person, the fire budget actually goes down this year.
I mean, if we were saying this is going to be strictly Town of Summers only, we were only providing a service in Summers, you'd never hear me complain about it once. But my responsibility is to guard the taxpayer's dollar and not send the taxpayer's dollar elsewhere.
So this
When
position
we
is
are
primarily for
walking
the
out the
ambulance.
door-
The ambulance is primarily in town. The medic's the one, as we admit, the medic's the one going out of town. This is to staff our ambulance nights and weekends.
But if we had our medic available in town,
But then
we wouldn't have a lot of these
But then you
problems.
still don't have necessarily, you're gonna have a medic running on a BLS call. You're not gonna have the medic available when you have the heart attack.
so how many medics are you staffing during the week?
Typically
During
one,
weekdays.
and then myself is second.
Actually, you have 3 on a lot of times. So you have
Sometimes,
so you have your 24-hour medic, you then have one of your medics that works exclusively day shift Monday through Friday, and then yourself, so you have 3.
If it depends on the rotation, yep.
One of your medics is not rotating.
He still doesn't work it's not Monday through Friday, 40 hours. They do the 12s.
Does he work weekends or nights?
No, but he works
Okay,
12 hours.
so he's working during the day,
But he
work
works Monday,
weekends.
Tuesday, Wednesday.
But where are
not
you having the
Thursday, Friday.
problems? Where are you having the problems? You're telling me weekends, nights, so why aren't we covering weekends and nights?
Because then we drop down to, we wouldn't have the extra staffing during the day.
But why do we need the extra staffing during the day?
Because that's when we're busier.
Because we're going out of town.
We're also, actually, we're going out of town more at night, because that's when Trinity's not
We're doing
available.
48% of our calls out of town.
But during the day is when we're typically busy.
That's not a small number. I mean, we gotta think about that. 48% of our medic calls are out of town. That's not a small number. That's almost 1 in 2.
And the out-of-towns aren't paying what, you know, what it costs to run it, is what it boils down to. I mean, we're gonna pay, it's gonna cost us almost $800,000
But we're
this
not
year.
we're not adding another medic to go out of town, we're adding a person to run the
No, you already
ambulance.
did. You already added the medic to go out of town. That's already here.
Correct, so, exactly. So now we're looking at how do we cover the ambulance in
So
town?
you just admitted you added a medic to go out of town.
No, we added a medic that covers
That's
our
what you
town.
just said.
But do they go out of town? Sure.
So, in the Tallinn County dispatch area, other towns are not staffed the way we're staffed.
No, they've all got paid 24 hours ambulances.
Otherwise, you tell me my logic is wrong. Otherwise, we wouldn't be called to go to those other towns. So they essentially know who's on the board, right? I mean, they know who's at each station, and they see Summers has 2, 3, other towns just have 1, but we can't send Willington to Stafford, we can't send...
They send Willington to Stafford all the time.
Well,
They do more calls in Stafford than we do, by a long shot. So does Tom.
all I am saying is that we must be higher staffed than other towns if we're the ones that are responding to that level, 50%.
No, actually, we're not.
Well, we're the only medics, that's why. We're the only paramedics. No other
It's the
town our
paramedics.
size in the state has a paramedic program.
Okay.
The ambulances aren't going out of town as much. And that's what we're trying to fill the gap right now, is fill the gaps on nights and weekends, to have the ambulance covered, and so that way we can tell the medic, if the medic needs to be in town, they're in town, if they have to go.
Right, but so when our medic goes out of town, we get reimbursed an insurance rate of $82 roughly for the medic to go out of town somewhere as an intercept call. It costs us $400 a call when it's all said and done, so we're losing $320 a call every time, for 48% of our calls. That's the issue. Like, you're like, oh, well, it's not the ambulance. You're right, if it were the ambulance, we might actually break even, but it's not. It's the fly car going over the hill, and we're losing $300 a call every time I watch it go right by my window over the hill, and
Yeah,
I'm like, well,
if we did
$300 out
If we
the door.
did to Stafford what Enfield does to us,
Yeah.
just go over, take it, and transport, well,
Absolutely.
then Alex Moore doesn't get what Alex Moore
Correct.
wants.
And if you,
And we get the money that we
so the
deserve
volunteers don't wanna
for
do that
making the
next
call.
week, because if you wanna put a paid staff on at night and then send the ambulance over the night, we could do that, and we could take the calls from Stafford.
Why wouldn't we cover Stafford?
That was his suggestion just now.
That's any town, though.
Yeah.
I mean, Stafford was 140 calls or 160 calls in the last 6 months. That's,
Yep.
you know, that's Ellington, that's East Windsor, that's, you know, I wouldn't care who it is. Every time we go and we hop on their ambulance and take a ride for 3 hours to somewhere before we get back, before we can respond to another call, that just cost us $300, because we got reimbursed $80, and it was $400 between labor, wear and
Your point was
tear.
put on the paid staff, you put on the paid staff, then they go with the medic, and then you take the whole call.
Why would we go out of call? The whole point is we want to serve Summers.
Correct.
There's
They're asking for
support, I think, for serving
We're
Summers.
legally obligated to send somebody
We are
to some of these
not.
calls.
So we are not. And I think you've seen the policies from Manchester and East Harper where they restrict.
And it
they're
didn't
out of
pan
town.
out, and they're still going to the calls.
That's not true.
It is true.
It's not true.
Manchester goes to the Windsor Vernon all the time.
They have restrictions, though, on when they send them. So, like, for instance, if we have one medic working in town, we don't send it out of town. It's available for Summers. If there's a rare case where we have a second medic working, then it's available. Stuff like that's common sense. I mean, of these 20 calls you're saying we missed, I'd like to dive into the data with you. How many times was our medic committed on a call out of town, resulting in us not having a crew? How many of these 20?
Don't know.
Well, that's right, but that's what I'm saying. I'd like to see the data with you. I mean, I've seen very little data. I mean, your graph here omits the most important part, that all of the increase in calls is out of town. The increase in Summers is negligible. The increase out of town is the entire spike.
Still up quite a bit.
I think the increase in Summers is
It's
measured.
notable as well.
I mean, maybe 100 calls, the increase in Summers. The increase out of town, you know, if we did just Summers, we'd be doing 1,400 calls a year.
No, we were higher than that. We were like at 1,800 for just Summers. Yeah. What is the number?
Not what we billed for, so if our...
But don't forget, you're not billing for fire calls, you're not billing for wires down,
We
you're
know
not billing
that.
for basement.
Right.
But we
No, I'm
had
talking
800
strictly
and something
EMS.
EMS calls out of town that we billed
Correct,
for.
and that's where I said, but the paramedics are also covering a lot of that stuff in town as well, as with these other paid positions. Because at 2 o'clock in the morning, I'm not getting people a full engine crew to go to Woodcrest for a fire alarm. They're not getting up to go to Sonny's place for...
But if our
Miles and
medics
bells
in
in.
Stafford, at 2 o'clock in the morning, do we have someone to go to Woodcrest?
Sometimes we do, sometimes we don't.
But we don't have the person the town of Summers is paying. I mean, you're saying their purpose is to take these alarms and stuff. If they're gonna call in Stafford or they're gonna call in Ellington, are they available for Summers? That's our point, Chief, and I think you've missed the point for the last 4 years. We wanna cover the town of Summers.
Yep, I can't legally say no to the other
You
calls.
can legally say no.
We've tried that, and DN Dispatch said, nope, you're hitting the tones.
Let's
And
see it in
legally,
writing. I want to see it in writing.
They have provided it in writing.
Is the dispatch calling us because we have the personnel on board and
Mhm.
other departments don't?
They don't have a medic,
Okay.
is what it is.
So if we only had one medic on board, we would still have to go.
Mhm.
They wouldn't tone AMR, they wouldn't tone Trinity, they wouldn't hit anybody else.
Trinity
Based
doesn't
on the rung
Trinity
card.
doesn't have 3 medics on at night.
It's
No,
based
but I'm
on the
saying
rung card.
Neither does Rockville Medic.
So
I'm
like if
saying in
Stafford
general,
changed the
they
rung
just go,
card,
you know what, Summers, you're
Yeah.
there, you've got a medic person, and we don't care, we're not even gonna call anybody else.
yeah, it's based on the rung card.
Based on the run card.
It's where, like Chief Roach has decided not to call the closest medic, like to my side of town, Trinity's the closest medic, but on his run card, it actually says Enfield will get called as a second medic. So like we don't even do it in our own town, we don't call the closest medic, and that's legal. It's probably not the right thing to do, but that's just the decision Chief Roach made.
Has to do with the mutual aid agreements that we have, but Trinity is next
Show me
to
the
that.
mutual aid agreement that says Trinity can't be first due to the east side of Summers.
It's with the agreement, Trinity is not interested in doing the first due to...
That's not what you just said, you said it's due to the mutual aid agreement.
Correct, we have a written mutual aid agreement with,
Enfield, it says they're first due?
yes, because they back us up as the first due, and
I
then
wanna
we
see
back
it.
them up.
Does Trinity have a mutual aid agreement?
No, they don't have a mutual aid agreement with us at all,
Right.
Why not?
because they don't want to sign one.
They don't have to sign one, but your run
Exactly,
card,
but
but your run card,
Enfield was willing to come to the table and sign the mutual aid
but
agreement.
your run card from Talon County could be changed to say that Trinity is first due for the east side of town, right? But you haven't done
But
it.
they're not willing to, they haven't signed it.
Trinity doesn't have to sign it. It would be through the Talon County Dispatch Center, you would update your run card for those quadrants, first due, second due, third due, correct?
Yep,
I used to do this. So why haven't you done it?
because we have the mutual aid agreement in place with Enfield, that they back us up, we back us up, and they've helped us out a lot of ways and a lot of times in the town.
So I should have to wait an extra 15 minutes at my house if I'm having a heart attack for an Enfield medic to respond from Route 5 when there's one at Johnson. Right? I mean, that's what I'm asking you, Chief.
Does Enfield sometimes respond from Hazardville, the
Yeah.
Hazardville station? Yeah.
And they're moving their station closer.
But what's closer? I mean, to my house, you know where I live, is it
Correct,
Johnson
but our
Memorial
districts-
closer, or is Hazardville
Our districts
closer?
aren't broken up by your road, it's it's by big chunks of the town. So yes, your road may be the exception, but right here at Town Hall, I would say Enfield probably can get here just as fast as some
Well,
of
let's look at the map. It's pretty broken up, the quadrant map. I mean, I've seen
No,
it.
we originally had 12 quadrants when I started here, we're down to 4. So the quadrants are not these massive, these tiny little chunks that we used to have. The quadrant maps have been completely redone in recent years.
Nice that you updated them.
Yeah, it was crazy.
Hmm.
Okay.
Okay, keep going.
Next slide going on, just, again, things that are coming down the pike. I talked to Mr. Keeney about this today. This finally just came out. OSHA is going through some massive changes to the, fire brigade standards. OSHA 1910.6 and 1910.156 was last updated in the 1980s. It is now getting a complete facelift right now. They're talking about phasing this in over the next 12 to 24 months. So not something that I will have to do immediately, but definitely things that play into some of these discussions. The big thing is that they took NFPA standards, which had been kind of a gray area as best practices for the industry, but not law, and they're making them law.
How are they making them law?
They're literally just saying, OSHA's saying, reference standard 1910.6 is saying, we are taking this NFPA standard, we are adopting it, this now becomes law. And they're doing it with the OSHA, they're doing it with the NFPA standards, and they're doing it with the...
Now, is this con-OSHA or federal OSHA?
Both.
Federal.
Okay. Well, 'cause the only one that their jurisdiction is
Correct,
con-OSHA.
there's federal OSHA takes it, but then con-OSHA can either meet or exceed that. So this is the minimum that Fed OSHA's saying, if con-OSHA wants to go further, they can. But this is what what's coming down the pike. Big changes that we're looking at, obviously changes to the PPE requirements, our bunker gear. SCBA, we've already talked about, this isn't a surprise.
Yeah.
Air packs are gonna have the 15-year retirement.
Are you
On
gonna
the pack
mention
and the
what the
frame.
OSHA changes are? You gonna mention?
I've got some of these next couple of slides, I'm
Yeah.
talking about the OSHA changes. We're gonna have to do a lot more community vulnerability assessments, on the fire and the EMS side of the house. So it's gonna be more than just having a conversation, but they're gonna be talking about full plans for prisons, Woodcrest, senior housing, things like that, new developments. Physical and mental fitness is coming down the pike, so routine mental health screenings is gonna be part of the fire department requirement. So that's gonna be costs and things that we have to do. They're talking about if you go to 15 or more fires a year, you're gonna have to get put into an advanced screening for lung carcinogens, things like that, health, cancer. So a lot of these things are coming down the pike. They have adopted nationally NFPA 1001, which is firefighter 1, which Connecticut never had. 1002, which means driver qualifications. So the days of just taking my volunteers and saying, hey, I know you know how to drive a farm tractor and a farm truck, you've got a Q license, you're good to drive the fire truck, not gonna fly anymore. You're gonna have to be a certified driver operator
Now,
or
is there
tanker
a
operator.
grandfathering period? Because typically it's like after a certain date. Like I know there's a lot of departments here, a
We're gonna
large percentage of their members are not Fire One trained.
This is completely changing that. They're gonna have to get it within like 2 to 3 years.
What's the effective date?
They're phasing, as I said, this is still,
12 to
they're working
24
on it
months.
right now. It's gonna be up to 36 months.
And then there's a lot of parts of the country though, I mean, just where it doesn't exist.
Correct.
I mean, I'm having a hard time believing.
And some parts of the country aren't OSHA states. Connecticut happens to be an OSHA state. So if you're not an OSHA state, OSHA does not apply to government entities unless it's con-OSHA, and con-OSHA says it applies to municipalities. So Connecticut made that determination. In a lot of parts of the country, federal OSHA does not apply to the fire department.
But I mean, a lot of them though, I mean, they're nonprofits, things like that, so they would be.
Yeah, this is gonna have ramifications. I mean, I was on a conference call today with 1,300 agencies just from New England.
Yeah.
This is a huge change. It's cultural shock for a lot of
I
people.
mean, obviously we want to comply. I mean, you presented before on the carcinogens, I mean, you have support, I mean,
Yep.
safety's a high priority for us.
Yep, but
We
as I
want
said,
to make sure that we have safe operations.
the level of training that's required now is they're up in the game. So
Okay.
we talk about hard time with recruitment and retention of volunteers. It's harder now when I can't just say in-house. In the past, I could do an in-house Q class and cool. Greg Smith could take them out for a few days on the weekend, drive them around the truck. We can sign them off on it, and they can get the license, and they're good to drive the truck. And the new requirements are like, no, you need to go through firefighter 1, and now you have to go through an actual driver-operator class, an NFPA driver-operator class. Not a bad thing, it's just, we talk about restrictions on the volunteers, what's making it harder, recruitment, retention, things like that down the road. Officers is the new officer standard, they have to be fire officer. For us, it's not a big issue, we've been doing that for years, but for like neighboring departments, that's gonna be a huge issue, is they can't just be fire 1 and, cool, I voted you in as lieutenant. You now need to have quite a bit of training to be in some of these positions. So definitely changes coming down the pike there. The other thing that they are doing is they're incorporating NFPA 1710 and 1720 into the new national standards, which is performance standards. So some of the proposed language is like, shall have the ambulance on the air or within 60 seconds, 90% of the time. That means volunteers responding from home is not gonna happen. They're gonna have to be in the station, we're gonna have to have people in the station. It can still be volunteers, but it's gonna change the nature, they're now gonna have to stay at the station.
A lot of
Again,
these are guidelines though.
these are gonna be OSHA standards, these are now gonna be requirements.
Yeah, OSHA's not gonna be able to regulate how fast the ambulance gets out the door. I mean,
Correct.
workplace safety and things, yes. How fast the ambulance gets out is outside the scope of OSHA.
That's not, though, they're actually putting it in.
Okay, well, it's outside their scope, so.
We can argue, but I don't wanna be the one with the fine.
Yeah.
But they're
No,
talking about
workplace
response matrix,
safety
so for firefighter safety, they're saying you have to have 6 firefighters on scene in 10 minutes, 10 firefighters on scene in 14 minutes, 16 firefighters on scene in 20 minutes. So they've got these types of metrics for departments of our size, our scale, our
Which we'd have no trouble meeting.
demography. Sometimes great, but this is not just for structure fires, this is at the fire alarm at Woodcrest at 2 in the morning. Can I get 6 firefighters on the scene at 10 minutes for a fire alarm? Maybe, maybe not. Even during the day, when I've only got 4 career staff.
But this won't be a unique challenge to Summers, it's something.
Absolutely not, but I'm just putting this as adding on to, we need to keep our focus on the fact that down the road, this is gonna be a big challenge coming to all of these departments, and us included.
Probably look at more regionalization and things as that goes down.
Absolutely.
Okay.
But that's why we're just putting it out there on on some of the discussion that we talked about. So that gets us into some of the more details of the budget. So for the budget, for the fire side of the house, the big increase is the additional full-time position, the 61,000. That's basically the primary driver of the increase on that line item. No changes to the part-time hours. It does include the contractual salary increases. So I know all the other town budgets does not include salary increases because it's up to the discretion of the board. Since this is contractual, I was asked by finance to include that. So we can, we've already got mapped out who's got what steps, what hours, what rates. So we know exactly where people are gonna be all year, so it made sense just to put that in.
Makes sense.
I'm glad you did, thank you.
Some of the costs are transitioned by some hours from fire to EMS. We had some people that were precepting this last year. So we knew that several months were gonna be fire months, and then when they got their medic, they transitioned to being fully in the EMS budget. So we took that into account for this upcoming year. So those hours are fully out of the EMS side of the house. And no hours, so that's dropped the fire requirement a little bit. And also just pointing it out there, don't know what's happening with the Stafford Fire Marshal program come July 1st, so we took that out. We don't have anything in there, so if it needs to be, it'll be an allocation or not, but that's up to the board and, if the town hires a building official, then it's a non-issue.
I would put it in the budget.
Okay.
I don't see any changes, I don't see us hiring any, 16 towns in the state of Connecticut are looking for a building official.
Yeah, we've tried, a
Summers
lot
isn't
of
the only
different
one.
options, and
And I wasn't sure, there's some rumor that Stafford may be hiring their own part-time fire marshals and looking to pull out of that piece.
If that's the case, then good for them. I would put it in there.
we've got a
because-
meeting coming up this next week, we might.
So that's what, and I'll leave that to the discretion of finance on that part.
Yeah, I know, I kinda have some mixed feelings on that, I don't know.
I'm not gonna die on the hill one way or the other, to be honest, so, either way, I'm flexible on that one. The EMS salary increase is $35,000. That is primarily for the pay raises, and as I said, also we moved the hours for people that were precepting. They're now full year on the EMS side of the house. I did also factor in, if we did do the full-time, there are some additional costs on the fire side of the house. Uniforms, cleaning, training allotment, things like that. So that's what some of those increases are. To your point, the volunteers have not been covering all of the shifts. We have been over budgeted the last year or so on the volunteer stipends, so if they're not able to cover the shifts, we're gonna take that money and help try and offset some of these expenses. So we took...
We've already taken some of it this year.
Yep, we've already taken quite a bit out this year.
Yeah.
We moved it to vehicle maintenance, so we're continuing next year, same thing, but even more than double that.
Okay.
And we took a lot out last year as well, that was
Yep.
kind of a...
Yep, so we took a lot out last year, we took a lot out this year, we took out more this year.
And obviously, we'll make sure every volunteer that earns a stipend gets a stipend, but we want to budget accurate.
Yeah, and there was some questions about the 20% rule. I did do some research. It is, I do have it here.
What's the 20% rule?
So basically, the 20% rule, it's an IRS rule, came out of a Department of Labor ruling. Basically says, August 7th, 2006, opinion labor, DOJ explained, an amount exceeding, not to exceed 20% of total compensation that the employer would pay to a paid firefighter performing comparable service would be deemed nominal. So anything below that, they're considered a volunteer, they can get nominal reimbursement. Anything more than the 20%, then they're considered a paid employee, and then they're subject to health benefits, dental, they're a part-time employee, the whole 9 yards. So very quickly, when you add in gas stipend, fire stipend, EMS stipend, uniform allotment, officer stipend, we're pushing that 20% rule, if not right at that threshold.
No, we need to be mindful of it, no
So
question.
it's hard for me, people keep saying, well, why don't we just up the volunteer stipends? I'm running into a threshold where the federal government says, if I pay them more of a stipend, now they become part-time employees.
No, they need to be a volunteer.
Correct. And so, that was the question that people would ask, why don't we just pay the volunteers a higher stipend and not pay part-timers? Why don't we just split the difference, and the problem is they become part-time employees.
Yeah.
Yep.
I understand.
No, I agree.
You're absolutely right.
So but there were some questions about that last year. I did do the research. And so that is,
Thank you.
Yep.
20% of the paid employee.
The average cost of paid employee.
Yep. Personal protection equipment, the next thing, we talked about this back when we talked about the, cancer prevention measures that came out for the state of Connecticut. We're looking to increase that, by almost $21,000. That's to go from 5 sets of turnout gear a year to 10.
Okay, makes sense.
That's a mandate.
That's the, yeah.
Yeah, and we support that, I mean,
Yep.
yeah,
Well, I would hope we would protect our people.
yeah, no problem.
So that's that one. EMS fire line adjustment, so again, last year, when we did the budget, it was kind of, we decided last minute that we were breaking the fire and EMS, and there were some things that we just didn't get a chance to work out all the details. Brian and I did meet, we did, listen to some of your concerns that we had last year. One of the big concerns was the paramedic overtime, which is the big driver of overtime. The paramedic overtime predominantly has been, actually, all the paramedic overtime is being moved from the fire line item to the EMS line item. So, we reduced fire by 29.4, we did increase the EMS side by 32. There's a little bit extra there just because of salary increases.
So I do have a question about that.
Yep.
I agree with you, Chief, and thank you for doing that. I was one of the ones that raised that. I mean, I think it confirms what we knew, that most of the overtime is coming through the paramedic coverage.
Yeah.
I guess my question is I have your paramedic proposal back, in very comprehensive proposal, the one you wrote back in 2019.
Yep.
And I'm just looking at your staffing here. So like, for instance, you lay out to the Board of Selectmen, the Board of Finance, that you really only need 3 paramedics plus yourself to cover a schedule. You have it all
3
here.
additional, yeah.
No, you said the bare number of staffing, is 3 paramedics.
If you wanted me on the road 24/7, and the Board of Selectmen at the time said
So
absolutely not.
hold on. So then you said option 2, though, is that we'd hire 4 paramedics, that'd be the optimal, and then the chief wouldn't have to cover shifts. And I think that's the option we went with.
Yep.
Okay, how many paramedics do we have now, excluding yourself?
5.
6.
6.
You don't even know how many you have. I know
Yeah.
how many staff you have and you don't.
I know we've got,
You have 6.
yep, and I've got one on medical right now, so I'm not, so, yeah.
Well, you have 6 staff medics.
Yep.
Okay, and so you have 2 more than you said you needed, and you did a nice schedule here and everything about how we're gonna staff the shifts. I'm just wondering how we're incurring $33,000 in overtime, or 32,000, when we're actually have 2 more medics than we said we needed.
Because one's been out on medical.
So that's the cost.
So if he's out on medical, he's not covering the extra shifts, and then
But you
somebody
still
takes
have
a sick on
5,
vacation.
so then you still have 1 extra medic.
Yeah, and somebody takes sick and vacation, you can only put them on so many hours in a row by contract.
Well, I think some of it's how you're choosing to make your schedule, because you're staffing heavy to go out of town. So like we went through this earlier, you're staffing 2 and 3 medics during weekdays because we're sending the person out of town. Why aren't we using those resources?
When we
to cover
can,
the
we do.
openings?
We do a lot. Our overtime would be 2 or 3 times if we weren't shifting people to cover those shifts.
But you're
all
trying
the
to
time.
staff 2 medics during the day, all the time.
No, we drop to 1 on a regular basis, sometimes we do 2, so it depends on what we have for people and
I mean, that's
staffing
not from the
resources.
schedules I've seen. I haven't seen you drop in a 1.
We did this morning,
For how long?
till I got in at like 10.
Okay, so for a couple
4
hours?
Well, they were all night, so midnight to 6, or midnight to 10.
Well, for midnight, we know. I mean, we have 1 on, although a lot of times we have 2 on.
No, at midnight, no, we don't, unless I'm here.
Sometimes.
I'm usually here at midnight, sure.
Okay.
I do a lot of work at midnight.
All right. I'm wondering though why, when we're overstaffed from what we said we needed, we're still having so much overtime.
Yeah.
And what we're doing to control the cost.
Yeah, the problem is they've got people are entitled to their vacation and their sick time, and the way it's been lining up, we can't always move people into those spots without, and sometimes if I know somebody's gonna be, out, I can move them ahead of time, but if somebody calls up at 5 in the morning and says, I'm gonna be out, the person that I would normally have wanted to move over, it's too late. I don't have the opportunity to move people to where I wanna move them.
But I mean, one of the medics you have scheduled, I've seen the schedule, not even to work nights or weekends.
Right now, yeah.
So why? I mean, why aren't we trying to get that person into a slot where
We're trying to
minimizing
eventually,
overtime?
there are some other issues going on with that
Okay.
individual right now.
Okay, thank you, Chief.
Yep. Other changes that we made to the budget, NFPA physicals, so it's literally, the physicals are a requirement to be an interior firefighter. So that really is a fire-related expense. So we just moved that, it's just basically a transfer from the medical, the EMS side to the fire side. Conversely, EMS did not have any place for equipment maintenance, so like the life pack monitors, we've got a service contract on those. But I didn't have a line item to pay the service contract out of, because all the equipment maintenance was on the fire side. So we broke that out. And then I did have to move some additional funds to vehicle maintenance. We were trying to do a balance. I think we didn't get that number quite right the first year. The ambulances particularly this year have had some pretty notable expenses. We were hoping to have one of the oldest ambulances replaced already. It's still a year or two out, so, we had to do, like, the suspension system had to get fixed. It needed new tires.
You had a tree fall on one too, didn't you? Yeah.
We had a tree fall on one of our ambulances, unfortunately, so
I would assume that's an insurance claim.
it is, but it's still a $2,500 deductible.
Deductible, yeah.
Still out for 2 months.
I mean, obviously, the maintenance we have to do, and
Yep.
there's support for that, I mean, no problem.
So that's why we're doing that.
Yeah.
Other increases or changes that we have in the proposal, TN went up 5%.
That just
We
came
had
in
some-
last week, right?
Yeah, we finally actually got the corrected numbers this morning.
Yep.
There was some back and
Okay.
forth, they had
Good.
two questions, they sent me some numbers. There was a typo in it that I didn't notice right off the bat. I called TN this morning, we corrected it. So actually the number came down, originally it was like at 53. So Brian and I, the newer numbers actually brought that down, back down to right about 50,000. The big change there is through TN, we do a bulk purchase with ESO software. That's about $5,000 a year. Their prices went up by 25%. So that was a big chunk of our increase through TN. We increased $1,000 on the line for fire hose. That's literally one length of 100 feet of double jacketed hose. LDH hose is $1,026. So literally that's one piece of hose. And medical supplies, again, we talked about last year, we needed I'd asked for an increase. We were told to cut it, leave it, actually it was left level set completely. We didn't get any increase last year. There was some confusion with the budget and finance at the last minute.
Were you asking for that last year?
So,
But that's a function of calls, though.
yep, somewhat, but some of it's a
I
function
mean, the
of
more
cost.
calls we do, the more medical supply. I mean, I went through the
Yeah.
invoices, we went through this last year. Medication, I mean, that's almost all of the cost,
Yeah,
is paramedic medicine.
BLS, ALS, it's all, yeah.
Very little BLS, yeah.
So it's there, either way, but that's coming out of the ambulance budget where the calls, it's tied back to call volume.
Yep.
So we're looking for an increase in that's the driving there. And that covers pretty much all of the changes to the fire department budgets, unless you've got any specific questions I've got on this one. Brian's got his, and this is, my sheet just has the fire and the EMS on the same page. Just so it's easier to kind of compare TN to TN and not jump back and forth and things like that.
So I guess probably my final question is, you're proposing this staff member to do what? This EMT? They're here to cover the ambulance is what I heard?
Fire and ambulance, nights and weekends, yep.
But you told me there's a problem with the ambulance shifts.
Yeah.
So I mean, they're here to cover the ambulance.
Yeah, and fire as well. Eventually the OSHA standards are gonna get to the point where we're gonna need...
We're not talking about those now, though. I mean, we're not trying to like build for the future, 5 years from down the road. We're talking about fiscal year '25 right now.
Primarily, yeah, the
So
ambulance.
it's to cover the ambulance.
Yeah.
So I guess my question is, why don't we put it in the ambulance fund?
The way we've got it split out is the EMTs are out of, because they're firefighter EMTs that do both.
But I mean, they're firefighter paramedics too. But I mean, this person's primary role, and it's an addition, it's a new person, is to run the ambulance. So why wouldn't we put it in the ambulance fund?
The way we split it out is EMTs are out of one and medics are out of the other. That's, if we really wanna move it,
I mean, but why wouldn't, I mean, I guess my question to finance then would be, I mean, did the ambulance fund make a profit this year? I mean, can we put it in there?
It's not trending to make a profit, it's trending to come in about
right about
anywhere
where-
from 20 to 30,000 under budget, or...
So if we added more cost-
Loss, yeah.
We would then just have more loss next year.
We would have probably a $90,000 loss, and then once we start talking buying another ambulance, and, yeah.
So we're losing money, and 50% of our calls are out of town. So who's making up the difference?
That's a good question, the taxpayer is.
Summers taxpayers, right? Stafford isn't, Ellington isn't. So Summers taxpayers are making up the difference for the loss.
Yep.
Okay, thank you.
Yeah, I would just point out, when I looked at the trends with Lisa's numbers, we should be breaking right about even for the year. So we're not at a lot, with the current staffing, the current model, we should be breaking even for the year. Because we brought in $391,000 at the 6-month mark. We were estimated to do what's it, 690, I think was the estimate, so we're gonna exceed the estimate.
Okay.
So we should basically break even.
Guess
plus or
we'll know on
minus a
July
couple.
1st.
Yep.
But we're not trending to a profit either, and I think if we put more cost in,
Well, we've been trying to move as much cost as we possibly can into that line item, so I mean,
well, shouldn't it be?
which is fine.
I mean, that's kind of the point, right? I mean, you put the cost to
Yeah.
where the revenue is, you try and match them.
Yep.
I mean, I've heard from years that we're making a profit out of you. You
No.
came in
We're-
year after year after year after you told us we made a profit.
And that's what we're trying to do.
So now we're
trying
doing
to-
it.
We're trying to do that, yep.
Okay.
So if we bring in,
I mean,
like I said, if we're at
Yeah, if
three-
75% of our calls are EMS, and we're saying our total budget would be let's call it 1.4 million for, or 1.5 for easy rounding. And if you took 75% of that and made that the EMS budget, you know.
Yeah, the problem is the big
would-
red trucks lose money every time they go out the door.
No, there's cost there, but we can break that. I mean,
There's
no
a lot of
question.
sunk cost there.
No question.
That's
Those are summer's
every
plus,
department in
I mean,
town.
yeah,
I could say
you know.
that about almost any department in town. I mean,
Right.
every time somebody comes and drops a bag of garbage off at the transfer station, I'm watching dollars.
Oh, yeah.
But,
You are?
yeah, I don't expect to make money on fires.
No.
No, but,
Or the transfer station.
correct, but at
Or the
some point.
transfer station, exactly.
But we're serving Summers residents, and there's no objection. My objection is to the disproportionate number of out-of-town calls that Summers taxpayers are subsidizing. That's my point.
And it's up to Brian, if he wants, wherever he wants to move it,
That's not up to me. It's up to
that's up to them.
the Board of Selectmen and the Board of Finance. I just make recommendations.
Yep. Any other questions on the budget?
No, thank you very much, and I know I'm in the minority, but Chief Roche, I support your recommendations.
Yep.
I would say, we support everything, I know I do, and that, I know Brian does, support everything in this budget, and that our only issues really are the cost of services to other towns, so.
Right, which we can't solve immediately.
I'm not saying we're gonna solve it immediately.
No.
All I'm saying is that's a concern that needs to be worked on with a solution and a plan.
Yeah, I mean, statewide, towns abusing their mutual aid neighbors is an issue that Vernon, Manchester,
But it's disproportionate here. I mean, when 50% of our calls almost are out of town.
but they're
I
not.
mean, that-
You're skewing the numbers, because
When you
We
say
not.
mutual aid, I mean, I really don't.
50% of our calls, we didn't do 12 or 1,400 calls.
Well, paramedic
Well, no.
calls.
EMS calls.
Yeah, EMS,
I'm
paramedic.
I'm only looking at EMS.
Correct, but that's not what he just said, 50% of our calls, that's not.
50%
We're taking
of
fire
our
out of
EMS
it. I mean,
calls.
fire's been out of this
Yep.
from the beginning of the conversation.
Right.
Correct, but the problem is fire numbers have actually still gone up slightly, and we're offsetting more and more of that cost toward the EMS, which is fine, but just realizing that the town's actually paying less and less, and we're doing more and more fire in town. It's not going up a lot, and it's getting buried because
I
EMS
don't think I
is so
follow
high,
your logic at all, but...
but,
Let me ask you a question about ALS in Stafford. I mean, Stafford has told us that they're working on building an ALS component. What's happening there?
I believe their first problem is they're trying to merge the three departments. That's their immediate,
They're trying to do what?
merge West Stafford Fire, Stafford Ambulance, and the town's trying to take control of the three.
What does that do for ALS?
The town would actually have right now they don't have money to do with the ALS program, so they have to get that under the town's umbrella.
Okay.
So they
we need
really
some
haven't done
urgency.
anything then?
I mean, we need some urgency, and that's what I've been pushing for 3-4 years.
Yep.
Because we're hemorrhaging money here, and Stafford's benefiting.
And Trinity's, hopefully, we were hoping that Trinity will take that up, more of that as well. I mean, we supported Trinity's application to come in and take the Stafford
we
calls.
did.
We actually put a letter of support in to OEMS.
Well, then you modified it.
Yeah, it said that whatever services that they offer, we should have the right to provide those same services as the town of Summers residents. That was the
I
modification.
think you supported them doing transports out of Johnson, I think. it was
No,
what
we
you
said they
modified
could, no, we
letter was.
never said they couldn't do the calls in Stafford. We've always said that 100% clear.
I mean, it
What we
wouldn't be
did,
up to you
our
anyway.
modification was, we didn't want the Trinity ambulances to have a service and say, oh, if you want to have this medicine or this procedure, you need to also call our
That was
medic.
in your first letter, but that's okay, that's
Yeah.
not what we're here to talk about. Okay.
All right, well, thank you very much for your time.
Thank you, appreciate the presentation.
Thank you.
Next Next on the agenda is a presentation by Ray Stovall for the Fire Department Union.
Thank you very much for allowing me to present today. Ray Stovall, career lieutenant with Summers Fire Department, as well as the union president. How's everybody doing tonight?
Good evening.
You guys all have a copy of my packet? Excellent. A lot of it was covered in Chief Roach's presentation. I'm just going to go over some of the additions that I have. As we know, volunteerism is down nationwide. I do have some numbers here that are Summers numbers. If you look at how many EMTs we've had on the books in 2019, we had 31 volunteer EMTs in the town of Summers. We're now down to 23 volunteers. And that's not even saying that those 23 volunteers are going to make all of their shifts. For EMRs in 2019, we were at 13. We're down to 15 right now. This is a definite trending thing. So the proposal that we're bringing forward is a progressive proposal to get ahead of the curve. In my opinion, the town should never have less than a staff paramedic and a staff BLS ambulance. And that's the bare minimum of what we should be doing. So if we look at unfilled ambulance shifts, Chief Roach had that in his presentation. It has gone way, way, way up. There's a ton of 6-hour ambulance shifts. You guys have everything right there. Call totals, I have them in here broken down from 21, 22, and 23. I broke them down to in-town and out-of-town. Hopefully that'll help clarify a little bit.
I think it's very clear, and I thank you for it.
Yeah, you're welcome. So our proposal, again, is to have an additional person on top of Chief Roach's proposed person. That will allow us to go to a 24/72 schedule with a guarantee of 6 p.m. to 6 a.m. weekdays of one firefighter paramedic and one firefighter EMT. That firefighter EMT is there to plug any holes that the volunteers don't fill on that ambulance, as well as do all the other duties that we do, as far as fire marshal, firefighting. We do tons of other duties other than just running the ambulance.
So how many full-time people you want to hire?
One additional on top of the one that Chief Roach is proposing, so that
So
is
two then, it'll actually be two from what you have currently.
Right.
correct, yep.
Okay,
So
that's-
my proposal
Okay,
is...
I misunderstood when I talked to you last Friday, I thought you were just talking about one. I didn't know there was another one already in the budget.
Yes, yep, Chief Roach is proposing one, and then I'm also proposing one.
Oh, okay, all right,
Yep,
thank you.
absolutely. So Chief Roach's presentation is a 9% budget increase. With the budget increase that we're proposing, it is a 16% budget increase. I think we came to 16.42
Something
was
like
the
that.
actual number.
Yep.
I understand that's a high number, but we need to be progressive and give the citizens of Summers what they deserve. I'm not saying the volunteers aren't doing their job, because they are. We have a very good core group of volunteers. The issue is we see an issue. We see shifts going unfilled. I think as leadership, we should be progressive and get ahead of that and fix that problem.
Sir, so you're saying that Summers has been shortchanged in the past, is that what you're saying?
Well, in the past, the volunteers were able to fully staff an ambulance. They were able to have 2 people on a BLS ambulance. So we talk about what happens when a paramedic gets dumped onto a BLS ambulance. If he goes to a BLS call at the prison and they transport somewhere, that's a minimum of an hour, 2 hours, where you're without your medic. Now, we keep talking about the paramedic going out of town. Is it the paramedic going out of town that's the problem, or is it the money that we're not recouping?
I would say the money.
The
Okay,
alternative,
so can you guys work with the towns to come up with a way to get more money?
We got a meeting set up for next
Yeah, I mean, we've tried that.
Okay.
And
We're recouping a fraction of the cost.
Oh, I understand, absolutely. So how do we get to where you would recoup more? That seems like a town hall issue.
well, to recoup more, you have to get the other towns to agree to raise their mill rates, because they're getting a premium service for pennies on the dollar,
There's no incentive on their part.
right?
Yeah.
And I use Stafford as the example. We're looking at our expenses, saying it's gonna be, hold on, what's in Chief Roach's budget? To run the EMS next year, $793,000.
Yeah.
Okay? A third of our calls for the year are in Stafford.
Mhm.
How much money do you think Stafford pays us for those 33% of our calls?
I don't have that number.
About $40,000. It's costing the town of Summers $800,000. They're paying 5% for 33%.
So you don't think they would be willing at all to go up on that rate?
They weren't a year ago.
Well, they do have new elected officials.
They have a new
They
administration
do
now.
have new elected officials,
Okay.
so maybe we could
So we
try.
can be hopeful,
Yeah.
yeah. hopefully we can recoup more of that money.
It would be nice.
But they
You wouldn't hear
also
me
talk
complain
about-
if I could get money from all the surrounding towns. You'd never hear me complain about a thing.
They're also concerned about our bankrupting their ambulance service.
Well, they're bankrupting ours,
They're
so-
bankrupting us and our taxpayers.
And our taxpayers.
pushback.
And that's who we're here to serve. I'm not here to serve Stafford's taxpayers
Well, I would
or anyone
hope that
else's.
if you presented these numbers to them calmly and professionally, I would hope that they would see the reality of it, and that we are giving them a break by, we're actually financing, their budget through our budget, correct?
I mean, you can hope all day long.
Well, I mean...
Yeah, what's the incentive for them to
I'm
change?
just saying, I don't know, I'm just saying that there's new people there,
If
maybe
you
they'll...
were, okay, let's pick up Summers, move it to Stafford. You're a taxpayer in Stafford.
Yeah.
And you're told your mill rate's gonna go up .8 mils so that you can have an ALS service versus we can have a wonderful ALS service. I'll never say anything bad about these guys. These guys are top notch. You can have this service for $50,000, or you can have a new service for $800,000. Which one are you gonna buy?
Yeah, I understand.
Okay, so what incentive do they have
Yeah.
to add their program? They're getting the program. They're getting everything when the tones go off, we're going across the hill,
I
we're doing the
understand
job.
that,
And-
I understand they don't have an
Right,
incentive,
so
but
why would they want, but
Well-
you can hope that they would want to increase it, but why would they want to?
I wouldn't think they want to, but sometimes people do see the need to be fair,
Yeah, it's all about
and that we're
sales.
providing a service for them, and maybe that they'll actually say, yeah, I guess we need to pay our fair share for the service.
It would be
we
nice.
We thought it was that way
Yep.
last year when we negotiated.
Yep.
We're pretty naive, yeah.
No, I'm just
So-
saying, maybe I am naive too, but I'm just saying, I would be very straightforward with them, tell them we really need you to help us out, because
A year ago, we were losing almost $200,000 going
I
to
remember
Stafford.
that.
Now we're losing about $125,000 a year
I
going
mean,
to
I've
Stafford.
offered the solution several times. It's a very simple solution. We cancel our bundle billing, and we bill them the maximum allowed rate, which is $960, I think, per call.
Sounds
And
about right.
we'll be fine. We'll be in the black.
We would
I
be.
mean, I'd like to do that tomorrow.
What prevents us from doing that, or prevents town hall from doing that?
I'm in favor, fully.
Billing's out of my control, so.
So I'd like to do that. I'd like to cancel bundle billing. I'd like to bill them the full rate that's allowed by the state. It's about, I think it's $960 a call for ALS.
Sounds about right.
And let's start that. I'm in favor. I mean, I think the board could take action, next meeting. I'm ready.
Again, I would hope that we could have a conversation
Yeah, I'm-
before we did a unilateral, thing.
Well, we've given them several years now to get their act together, and there's been no movement at all, so.
I'd like to understand what that would mean if we increased our bundle billing, or eliminated it.
Yeah, we can do that analysis.
It would mean instead of $150 a call, we would be getting $960 a call, or whatever the billing rate is.
Who's paying that?
Either
The patient would,
Either
yeah.
the patient or,
Patient or the insurance company.
I think then the Stafford decision makers would
What
be
about
paying attention.
Because right now,
patients that don't have
they
insurance?
bill it, Stafford gets the $750 and we get the $150
That's right.
instead of getting
Right.
the
We
$900.
get the agent's cut, yeah. Yep.
Okay, so that brings you back to my proposal, which is more about the residents of Summers. And seeing an obvious issue going forward,
Right.
we need to try to fix that issue. Are there any questions so far?
So you're trying to be prospective,
Absolutely.
anticipating
We're
what's gonna
anticipating, we're looking at
be
the
happening to
graph.
volunteers and,
Well, you can see where the trend is going,
Absolutely.
and that trend is true all across the state, and not just in this state, I know it's true in other states too.
Definitely. I tried to tailor it more to Summers so we can get an actual idea of what's going on. But again, all I'm asking for is that we staff an ambulance and a paramedic 24/7, and we keep our 4 on the floor during the day. This allows us to keep our 4 people, as well as have the extra person on nights with the medic and weekends with the medic.
Yeah, I think it's good, because I think you're guaranteeing we're gonna have good quality care all the time.
Mhm.
Isn't that what that's your goal?
how does that relate to affordability?
I mean, it's another $100,000.
It is.
So, and my question is, if you guys are looking this way, why isn't it part of the chief's proposal? What's the separation there that's keeping it out of what was originally proposed?
Why are you not in alignment?
Yeah.
Because the chief is coming in with one person to plug holes. I think that's gonna be a hard sell, looking at it from a union standpoint. I don't know many employees that are gonna wanna just work and plug holes in shifts. So there's a little bit of a disagreement there. I have a blanket agreement where we can get this coverage. Yes, it's gonna cost a little extra money, but we're gonna have consistent coverage. And we're not gonna be getting rid of the volunteers, we're gonna be working with the volunteers. I've talked to all 3 volunteer chiefs, they're in line with what we're doing, and they agree that we're not trying to push the volunteers out. What we're trying to do is fill gaps and be able to give the most consistent, high-quality, service to the citizens.
And we're turning over every rock we can to save the citizens a dollar.
I get it.
And we're trying to be creative while we do that. So if you can come up with some creative solutions, that would be helpful too.
I will certainly look. We talked about SAFER grants. Not many departments are getting SAFER grants nowadays, and it's usually departments with different demographics that are getting SAFER grants. There's not a lot of options out there.
So, in what Chief Roche presented to us, how much would that budget then increase with your proposal?
With our proposal, it's an additional $100,000.
$100,000 on top of what his increase?
Correct. His is a 9% increase, this is a 16.42% increase.
Okay.
Okay, thank you very much.
Thank you.
I appreciate
Appreciate your
all your time.
presentation.
Thank you.
The next thing on the agenda is the approval of the minutes of January 25th, 2024. Hey, Bern? Hey, Bern?
Got the date correct this time.
Yeah, correct date this time.
Oh, thank you, yeah.
We're in the
I
right.
get it right occasionally, yeah.
You didn't have to update it, it was already there.
Make a motion to approve the minutes of the January 25th, 2024 meeting as presented.
Second?
Any further discussion on the motion? All those in favor say aye.
Aye.
Motion passes, thank you. Motion to adjourn.
Motion to adjourn.
I'll second that.
And we're adjourned.
Thank you.